Good morning, class, and welcome to East Lincoln Animal Hospital. This is where I work, along with several associates. Our clients arrive with their pets and enter through the front door here. And we'll walk in and greet the receptionist and see what it's like on a trip to the vet. See how this works out. Say hi to Rebecca, my daughter. Say hi to Abigail's kindergarten class.
Hello.
Welcome to East Lincoln Animal Hospital.
Hi.
This is the reception desk where our clients are greeted with their little pets and their carriers. I'm going to show a film to the class tomorrow, and they're going to laugh like crazy. So, we have pet food here. If the pet needs a special food, and they're invited to an exam room. We have exam rooms on both sides. They'll just have a great time watching this, won't you? They will. They'll hear all this. And we have exam rooms that the client brings their pet back into. This is exam room 5, where there's a table to put the pet on and places for people to sit. And we look in their ears with a stethoscope, maybe. That's the stethoscope, an ophthalmoscope. And we show them models of their backbones, or their knee bones, or we take their temperature with a thermometer that we have to put in their and then we can wash our hands, and we put the information about the pet in the computer so that we'll have the records for the future. If we need to call someone to talk about the case, we can call them. And this is where all the medicines are kept. We have a pharmacy of medicines at East Lincoln. This is one of the veterinarians and staff. And they're talking about sick animals. This is Abigail's class tomorrow. Say hi, Abigail's class.
Hi.
Okay. We're so excited. We'll be happy to see
Show her
this.
the chinchilla?
No.
It's in remote.
Okay, we have a special patient here today. This is Dr. Crawford, and a special patient. Most pets at East Lincoln are dogs and cats, and it's lunchtime right now, so there's not a lot of patients here. But Dr. Crawford's going to show us her chinchilla patient.
Shut the door, Dr. Wilson, so he doesn't escape.
Okay, how exciting is this?
He's a really cute chinchilla.
Oh boy, what's his name?
His name is Elliot.
There's Elliot, the chinchilla.
You know what, Elliot, you could probably have your water ball there.
Is a chinchilla in the rabbit family?
Rodent. Yeah.
Rodent family.
Mm-hmm.
It's a fancy rabbit, kinda. Where's their native home?
I think
Chinchillas.
South America, but
South
I'd have
America,
to look it
probably.
up. I'm
They're
not
not
sure.
native to the United States.
They are not.
Isn't he pretty?
Isn't he pretty?
Elliot is really pretty.
If I get a little
That's
towel, I
so-
can hold him for you.
That's
He's
okay.
really squirmy.
That's okay. We'll open that door and we'll go look at the surgery room now.
Okay.
This is only about 5 or 7 minutes.
Bye, Elliot.
Say bye. Okay, there's Dr. Johnson.
Hello.
This is Abigail's kindergarten class tomorrow.
Ah.
They're getting a tour today via a recording if I decide to show it, which I probably will. And this is where we work on pets to do surgery or other treatments. We put them on a table, and they might get fluids given, just like people in the hospital get fluids given with the veins. And this is Dr. DeMaster putting a patient's medical history in the record, which is very important. Hey, this is Dr. DeMaster. That's Abigail's kindergarten class. Hey, hello. There's Cynthia, our pharmacist. She makes sure all the medicines that we order are given correctly. Show them some pill bottles where all the pill bottles stay. Pull out a drawer and show them. There's all the bottles. Pick one up and show it to them. We've got all kind of pill bottles for pets. Okay. Make sure the label's just right. All the medicines have to be very careful to make sure they're just right. This is where we do blood tests on their blood. There's a microscope, like you heard about, to look at their blood samples and other samples. And this is Well, we're about to see a pet under anesthesia. This is Billy. He works on the surgery animals, and this is one of the surgery areas. He's cleaning up after the morning surgery. That's actually a lead apron that we wear during taking x-rays. And we can actually take x-rays of teeth just like your dentist might take x-rays of your teeth. There's a little dental x-ray. But you get your teeth x-rayed when you go to the dentist. We do animal dentistry at East Lincoln too. Now we're going to go into the surgery room and see a pet under anesthesia. This is the machine that gives the anesthesia gas. And it's breathing through the machine. And the wires tell us that the heart's beating. You can hear the little beep, beep, beep. And this is its anesthesia monitor with the beep, beep, beeps. And you can see the electrocardiogram going across the top there, beeping. Perfect little electrocardiogram. And the other signs are oxygen in the blood. And you can see that being registered across. Hear the beeping, so we'll know the heartbeats. Billy's working on making sure those records are correct carefully. Dr. Johnson's got on her mask and a cap, being all clean and sterile, and clean and sterile instruments. How perfect timing is this? With your permission, of course. Kindergarten is a wonderful gauge. We're not going to show them the blood, but we'll show them to get ready for. There we go. She's going to take a lump off this dog in about 15 minutes or less, probably. Thank you, Dr. Johnson. Good luck on your surgery. Bye, Billy. And that's where Elliot was. And we'll go look at the place where the animals stay when they wake up. They have to live in these little cages temporarily. Kennels, we'll call them. There's a kitty cat. And a puppy dog, and there's another kitty cat. And they have to have their name cards on the cages, so we'll make sure we know who they are. There's another little puppy dog. Now we're going to go look at there's where they take the x-rays. There's the machine that makes the x-ray picture. Sometimes we have to give them gas to do that, and they lay on the table, and the x-ray comes up on the computer screen. We're going to tell that machine to show us an x-ray here that we've taken today, maybe. Because they're digitized now. And that's Janet. She's wrapping packs to make sure they're all clean and sterile. And there's the x-ray we took this morning of the dog's big belly. And we were looking for, there's its bones, and the intestines and the abdomen and the ribs that we have to look at and make sure they're all healthy at East Lincoln. We can do all these things for pets here at East Lincoln Animal Hospital. So there's a lot of exciting things that go on at East Lincoln. We have a lot of helpers and a lot of rooms with tables for people to bring their pets to come see the vet at East Lincoln. And then when you're done with your visit, you go back to the front and check out and say goodbye.